Welcome to your COVID-19 special. I'm Chelsea Delaney in Berlin. Travel restrictions are tightening once again in Europe. Last week, Germany classified all neighboring nations as high risk, while France banned all tourist and business travelers from the UK. This as the British government says it's facing a tidal wave of new infections fueled by Omicron. The UK recorded a leap of 72% in the number of daily cases compared to the week before. At over 82,000 cases per day, it's more than any time during the pandemic. DW correspondent Charlotte Chelsom-Pill reports from London.
Festive cheer on the streets of London, once again ringing hollow. Shops and hospitality may all be open. Christmas parties still allowed to go ahead as planned. But COVID is casting its dark shadow over the days ahead. As experts warn, the Omicron tidal wave is coming, and it's coming at a phenomenal pace.
What we know is that it reproduces very, very fast. A week ago or so, we said it reproduces every 2 to 3 days or 3 times a week. And putting it very simply, that means in 1 week, you get 8 times as many infections, 2 weeks, 64 times as many, 3 weeks, 512 times as many. So it's coming at us like an express train.
The UK is already recording record COVID cases, with Omicron now the dominant variant here in London. Resisting calls from some for further restrictions, the government's focusing instead on its booster campaign, resulting in lengthy queues at vaccine sites across the country.
Obviously, the Omicron is growing so rapidly in London, and we just wanted to get in as quickly as possible.
So many people that I've heard of are getting COVID again. From last week, there was an office party of 40 and 16 of them got COVID. Clearly, Omicron is really spreading quickly.
It's very relevant or very important for me to come here today for all 5 hours. Not that I want to make an issue of it, but I live with my mother and father, who are in their 80s.
I wanted to ideally get it done before I went to go and see relatives and people over Christmas. I can't feel my toes, though, but it's okay. It's okay.
The government's throwing the doors open to every adult in England to get boosted by the end of the year. They're hoping to offer up to 1 million jabs a day, as early data suggests the third vaccine is key to combating Omicron.
This is a massive undertaking for the health service. They're being asked for another major vaccine push to try and prevent hospitals like this one from being overwhelmed. But there are concerns it won't be enough. As people here line up for their boosters, there are already people in hospital with Omicron.
Hospitalisations are climbing, and one person's confirmed to have died with Omicron. While it's not yet clear how severe the variant is, the sheer number of cases alone could prove overwhelming. In the shadow of this vaccine centre, a reminder of what's at stake. A memorial wall commemorating the tens of thousands of lives lost to COVID. And it's with the pain and sacrifice of the past that this weary nation is now facing the threat of another worrying winter to come.
Well, for more on the situation in the UK, let's talk to Julian Tang, a clinical virologist at the University of Leicester. Julian, thank you for joining us. The situation in the UK is already bad, but recent models from the London School of Hygiene and Tropical Medicine indicate it's about to get a lot worse. They're forecasting between 25,000 and 75,000 deaths from Omicron by the end of April. What will the coming months look like for the UK?
Yeah, so there's some questions about those models, and they have been wrong before, overestimating the number of deaths and cases. One of the key things about the model is that they're trying to model the severity of illness from neutralization studies that have been done in the lab as well. We know from previous attempts that severity of illness is very hard to model in that way. I suspect that the number of infections may be closer to the mark, but the number of hospitalizations may be less than the model predicts in the most pessimistic scenario. Even in the most optimistic scenario, there may be not as many hospitalizations, so we just have to wait and see. And also we know that T-cell responses are also very important in keeping people out of the hospital and having more severe disease. And T-cell responses are not really correlated in the model. They mainly focus on antibody neutralization results.
But no matter what way you really look at this, the UK, the rest of the world, is facing more cases, more hospitalizations. Is that avoidable in the UK?
Now it's difficult because they've left it very long. Once you start to see the peak of these cases now, due to Omicron, essentially the horse has bolted. So even though you impose restrictions now, there are a lot of viruses, a lot of people out there who are seeding the Omicron variant across the population. And of course, Delta hasn't gone away either. The restrictions will reduce both variants in terms of infections and hospitalizations and deaths, hopefully. But now it's very late on to do this. And with Christmas and New Year already upon us, the socializations will have increased even as we speak, even behind closed doors.
We've seen in recent days countries like the Netherlands returning to lockdown. Do you think measures that strict, a potential lockdown, are coming in the UK?
So from a purely virus point of view, I think that's probably what's needed if they want to achieve that goal of actually reducing the spread of Omicron. And not just for 2 weeks, as some have said already. I think for at least 4 to 6 weeks, you're going to have to use that kind of measure to really lock down the virus. But then, of course, you have to consider hospitality industry and the economy in a wider sense, as well as social, psychological welfare. So it's going to be very hard to strike that balance between those two extremes.
One of the challenges here seems to be that we don't know a lot about Omicron right now. There's still a lot of unanswered questions about how deadly it is. How can governments, including the government in the UK, draft health policies when our understanding of this variant is still quite limited?
So this is the issue of the precautionary approach in infection control. If you're not sure about how severe the virus is or how fast it spreads, you put in place measures that will cover those eventualities even at the most pessimistic level. Now, of course, that has a knock-on effect for education, society and economy. But if you're purely looking to control the virus, as some of the Southeast Asian countries have done very well, and that's the kind of restriction and measures that you need to impose early on. And then you can reap the benefits of that later on when you open up, once the virus is down to virtually zero. At the moment, the UK and other European countries, the numbers are just far too high for that. So what you're looking for is a mitigation of that peak, and hopefully something that you can live with, as well as not overwhelming your local health services.
You mentioned there the effective measures we've seen in South Asian countries. What exactly did you mean by that? Can you elaborate a bit on what those have been?
Yeah, so right at the beginning of the pandemic, when they weren't sure about the virus as well, the original Wuhan strain, they went into universal masking, enforced isolation and quarantine of infecteds and contacts, where they had security tags on wrists and ankles and mobile phone apps to track if anybody broke those isolation and quarantine orders. Even in France, they made everyone stay at home, and they needed written permission slips to actually leave the house for essential business. And that kind of measure did actually work very well to stem the tide of COVID in the first wave. And now with more people vaccinated and having had natural immunity, then the risk of severe disease and death is much less at the moment. But if you want to reduce that risk of overwhelming the healthcare service, because they're dealing with other things now in the winter months, then you may need some kind of lockdown or at least something similar to restrict those numbers even further, given that they're already at 80,000 now.
So, Julian, taking the long view here, many in Europe had really hoped this Christmas would be different than the last. It doesn't appear that that's going to be happening. Do you see a risk of this pattern every winter just repeating itself from now on?
No, so on this point, I'm more optimistic than some of my colleagues. I think this virus is now adapting to the human population. The number of spike protein mutations, the rapid spread with less severity from data coming out of South Africa, and also some early data now from Hong Kong and also Cambridge suggests that the virus replicates better in the upper rather than lower respiratory tract. I think these are all changes that I'd expect to see for a virus that better adapts to its human population host. And over the next few years, I think what you're going to see is a milder and milder form of the virus that might spread more rapidly, but for which most people may not need vaccination.
That is Julian Tang, a clinical virologist at the University of Leicester. Thanks so much for your analysis.
Thank you.
Now it's your turn. Here's a viewer question for our science correspondent, Derek Williams.
My husband was vaccinated, then 2 weeks later tested positive for COVID-19. Could that be due to the vaccine?
No, but depending on what kind of test he took, for different reasons. There are basically two different types of diagnostics. The most accurate is called a polymerase chain reaction, or a PCR test. Now, it works by amplifying tiny amounts of SARS-CoV-2's genetic material in a sample up to levels where it can be detected. Exactly why vaccines can't cause a positive PCR result is complicated scientifically, but more or less comes down to the fact that most of the currently approved vaccines don't use a full version of the real virus to kickstart an immune response. They instead contain short stretches of genetic material that don't replicate, that degrade fast in cells, and that aren't detected or amplified by PCR. The second class of detection diagnostics, called antigen tests, they work by revealing the presence of certain proteins that are specific to SARS-CoV-2. They're cheaper and faster, but also less accurate than PCR. Because some vaccines cause your body to produce the coronavirus spike protein to kickstart your immune response to the pathogen, it doesn't seem impossible that an antigen test, which detects proteins, might be confused by that. However, to avoid any confusion, most commercial antigen tests are not designed to detect spike protein, but other coronavirus proteins. In addition, vaccines are injected into the arm, but detection tests, they swab the nose or the throat. The cells there are not the ones producing spike proteins after vaccination. So, long and short, vaccines don't cause COVID-19 tests to turn up positive. The presence of the virus does.
Thanks for watching.